Hello everyone. What a long title for an award we won there for our project. I'm Charlotte and this is Jenny and we're from Cheshire Merseyside Cancer Alliance, and we're truly honoured to be here today. We were honoured to be shortlisted. We can't quite believe that we've won. Listening to all the amazing projects that are here, we're really honoured, so thank you all so much.
Thank you. Hi everyone, as Charlotte's just mentioned, we're amazed to be here today and thank you very much. I hope you enjoy our presentation. So Charlotte and I are part of the Health Inequalities and Patient Experience team at Cheshire and Merseyside Cancer Alliance. And along with our amazing patient and carer representatives, we believe that lived experience should be at the very heart of every project. And we've actually made it mandatory at the Alliance now to include patients in project work. And in order to tackle health inequalities and improve patient experience, we must listen to those that are using our services. We're really proud of our Patient Stories work stream, and we love working with our patient and carer representatives. I will skip through a couple of slides now because we have got a video that we really want to show you.
So I just want to give a bit of a background about our patient and care representative involvement in the Alliance. So at the moment we've got 69 patient and care representatives, and they're including people panel members. And since 2022 we've had over 70 stories shared, and they're shared far and wide. They're shared within the Alliance and they're shared with the wider system as well. Our patient care representatives are involved in so many projects, 168 since June 24. And we've got a patient representative that's become one of the national PPV partners. And we've got a patient representative, Kevin, here with us today, who's been also shortlisted for one of the awards. So we're just going to share a little video, so hopefully this will work.
On the 23rd of May 2022, we invited our first patient storyteller to a Cancer Alliance team away day. The impact of hearing the patient's experience was so powerful, and it's since motivated our colleagues across the Alliance to invite patients to share their stories to support improvement programmes. Since 2022, stories have been shared far and wide. Now, as we know, often the impact of sharing patient stories can be really difficult to measure, as viewers may not make immediate change in response. However, these stories can leave a lasting impression, keeping the patient voice present in mind as services are developed. At the Alliance, we are aware of 6 significant changes that have been made as a result of sharing our wonderful patient and care representative stories. And we are here today because of our storytellers, so we're going to have them take the stage. Rita shared her story at a Liverpool wellbeing event, which then gained media attention.
Now, a Merseyside woman says a routine cervical screening, which she almost missed, saved her life. Rita Doyle's cancer diagnosis was picked up in December 2020. This week is Cervical Screening Awareness Week, and Rita is urging others to attend their screening. Well, I'm really pleased to say that Rita joins me now. Rita, first of all, how are you?
I'm very well, thank you.
Yeah, you're doing
well.
good.
Very well, yes.
So just tell us, first of all, about your story, because, as we said, this was a routine screening, as we're now calling them. They're not called smears anymore. But you almost didn't go.
Yes, I got the text reminder. I looked at it, put it to one side almost, and didn't think that at 58 I needed to worry about cervical cancer.
Rita's story had a profound effect on the audience at the wellbeing event, with many attendees providing feedback that they plan to book their cervical screening appointments immediately. The media coverage further amplified her message, spreading awareness about the importance of cervical screening to an even broader audience through radio and television. Rita's advocacy really highlighted the critical role of personal stories in encouraging preventative health measures. Fiona shared her challenges as both a wheelchair user and a cancer patient during a board meeting.
My name is Fiona, and I was diagnosed with breast cancer in August 2016 after a routine mammogram. I had a lumpectomy followed by radiotherapy, 3 years of zoledronic infusions and 5 years on letrozole. I also have multiple sclerosis and I'm a full-time wheelchair user. The treatment that I received from the National Health Service from the initial diagnosis to being given the all clear was first class. But as a wheelchair user, I experienced a number of inequalities relating to the physical accessibility of premises, equipment, including scans, etc.
Fiona's experience resonated deeply with the board members, prompting them to request a system-wide accessibility review of cancer services, which aims to address the challenges faced by patients with mobility difficulties and ensure more inclusive and supportive healthcare practices. Stacey has spoken at many events and training sessions, sharing her experiences to highlight the barriers she encounters. Her story underscores the importance of lung cancer awareness, the need for symptom checks, and the value of attending screening appointments. Stacey's story later gained attention from local media. This provided her with the opportunity to share her story far and wide, allowing her experiences to reach a broader audience. While it's challenging to measure the exact reach of Stacey's story, the opportunities to share her experience ensures that her voice resonates widely. The resulting impact is both significant and powerful, driving meaningful change through awareness and advocacy. Glyn shared his story and promoted bowel cancer screening through a local radio station.
Glyn Salmon is a patient's representative for Cheshire and Merseyside Cancer Alliance and joins me now as well. How are you, Glyn? You okay?
Hi, Jade. How are you?
I'm good, thank you so much. Thanks so much for being on the show today. Your cancer journey started a few years ago now, didn't it? Can you tell us a little bit about that?
It did. Polyps in my early 30s, and then about 10 years ago, started having symptoms typical of what the doctors just said, really.
Unbeknown to Glyn, his story prompted his own son to visit a GP after experiencing symptoms. This proactive step led to the removal of polyps, potentially preventing more serious health complications. The story illustrates the significant influence of patient advocacy and the power of shared experience in driving life-saving actions. At a diagnostic away day, a storyteller shared their cancer diagnosis journey, highlighting anxiety and emphasised the need for more accessible options for blood testing.
A term used within the cancer community is scanxiety. Now, this is where you experience high anxiety levels due to waiting on scan results. For myself personally, I have scans every 3 months, and then I usually wait around 3 to 4 weeks for the results of those scans. In that space of time, the anxiety that I experience is extremely high. I know that it wouldn't make sense, but in my mind, I can't help but let it run away with the possibilities of what if my cancer has spread.
The storyteller's input led to significant changes within the diagnostic programme, including the introduction of more accessible blood testing options. The programme have since requested a storyteller to deliver a narrative at each diagnostic board meeting to provide valuable insights. And additionally, one of our storytellers has joined the Pathology Network Transformation Programme Board as a member, ensuring their perspective continues to shape the healthcare initiatives. Jo shared her experience during a leadership meeting with the Cheshire and Merseyside Provider Collaborative.
The problem with the wait was that, for me, it just solidified that it's not serious. Everyone I spoke to was saying, well, cancer's urgent, so if you've been deferred a week, it must be because you're fine. So when I went into that appointment, I was in a state of shock when I realised the truth.
Inspired by Jo's story, the Cheshire and Merseyside Provider Collaborative developed a People and Communities Experience Toolkit. This innovative resource aims to ensure that the voices of individuals and their communities are embedded in all programme projects. The toolkit represents a significant step in highlighting the importance of patient stories and fostering community-centric initiatives.
We cut that fine there with time, but that is us done. There's just some storyteller links, so when it all gets sent out, people will have access to that. And that's us. Thank you, everyone.
Thank you, ladies. Can I take that off you? Right. Any questions for the Cheshire and Merseyside team? Yes.
Thank you so much. That was really, really powerful. I think for me, I think what is really key here is that the differentiation between empowerment and self-determination for our communities and patients and public. And I just wondered if you could share, in light of sort of like, you know, restraints and challenges around resources and funding, what those small key wins were around small things but big gains around self-determination of those patients and public in what is huge in terms of the power of narrative and storytelling and their experiences in influencing others, particularly around not only diagnosis but also self-determination and dealing with that, you know, anxiety around scans and what the navigating health systems. So I wonder if you could share those small key wins and whether there's any toolkits or anything you've created in capturing those small wins.
Yeah. Hi, thanks for your question. So we have actually just created some patient engagement resources for other people to view. They're on our Cancer Academy platform, so they're available to anybody to use, and there's tips on everything we do patient engagement wise. There's a how-to guide animation videos for planning a roadshow to get out there and speak to members of the public. There's how-to guides to create your own readers panel. So that's a panel of cancer patients and carers who review documents before they're actually published. I don't know if there's anything else you want to add to that.
No, I think it's up to, we take our patient stories to whoever wants to see them, and we are drumming on people's doors saying, can we bring a patient story to this meeting? Can we share a patient story here, there and everywhere? And then I think when the programmes hear those stories, they realise that they need to make changes. So then they're the ones who are then going, right, well, what can we do to improve this service? We're just starting that thought process, which we're really proud of, because without having our wonderful patient representatives, that wouldn't be happening. So we're here, but it's our patient representatives that do all the hard work. So we're very thankful, aren't we?
Yeah. One more question. We'll take the question here.
And do you only use that in your cancer services, or does your trust now use it in other areas as well as the cancer services?
So is that in relation to Joe's story? Yeah. The exact name of it, I will come back to you on. Sorry. But yeah, it is just used in the cancer services at the moment. Yeah, but it is something that maybe could be rolled out alongside other organisations as well.
And is it accessible to other trusts to be able to have a look at?
I don't think it is it?
It's not.
It isn't, but we can definitely have a chat and see if we can share it and pinch with pride. We always say that. Pinch with pride.
Pinch with pride's our motto. So if anyone wants to get in touch and wants access to that, we can certainly ask for you, not a problem.
Yeah.
Thank you.
Okay, brilliant. Thank you very much indeed.
Thank you. Thank you.